Are you over 50 and starting to notice those annoying prostate issues, like getting up multiple times at night to use the bathroom, a weak urine stream, or even feeling a bit of discomfort down there? You're definitely not alone. Millions of men deal with this every day, and the supplement industry is cashing in big time, promising quick fixes with pills and powders. But here's the harsh truth. A lot of these products are overhyped scams that could drain your wallet without delivering results, or worse, cause side effects. What if I told you that some supplements do have real science behind them and can actually help? In the next 15 minutes, I'll pull back the curtain on the most common prostate supplements, share what the evidence really says about what works and what doesn't, give you tips on spotting quality products, offer lifestyle advice to support your prostate naturally, and teach you how to dodge the scams. As a doctor who's treated hundreds of patients with prostate concerns, I've seen what makes a difference. Stick around. This could save you time, money, and frustration. Hi, I'm Dr. Rebecca Lawson, a board-certified urologist specializing in men's health for over 2 decades. I've helped countless men navigate the confusing world of prostate health, from benign prostatic hyperplasia, or BPH, which affects up to 80% of men by age 80, to more serious concerns like prostatitis or even early signs of prostate cancer. As we age, the prostate gland can enlarge due to hormonal changes, inflammation, or lifestyle factors, leading to symptoms like urinary urgency, weak flow, incomplete emptying, and even impacts on sexual function or overall energy levels. The supplement market is flooded with options claiming to shrink your prostate overnight or restore your manhood, but most are based on shaky science or outright false promises. Today, we're cutting through the noise with evidence-based insights. We'll review 7 popular supplements, debunk myths with real studies, discuss what to look for in a quality product, share proven lifestyle tips, and highlight scam red flags. By the end, you'll feel empowered to make informed decisions. Let's jump in with one of the most marketed ones. First up, saw Palmetto, derived from the berries of a small palm tree native to the southeastern United States. You've probably seen it in every drugstore prostate formula. It's marketed as a natural way to shrink the prostate, reduce inflammation, and ease BPH symptoms like frequent urination. But does it live up to the hype? Let's look at the science. Early small-scale studies from the 1990s suggested it could improve urinary flow and reduce nighttime bathroom trips by inhibiting the enzyme 5-alpha reductase, which converts testosterone to DHT, a hormone that contributes to prostate growth. However, larger, more rigorous trials funded by the National Institutes of Health, involving over 200 men, found that saw palmetto performed no better than a placebo in reducing prostate size or alleviating symptoms over a year. So while it's generally safe with minimal side effects like mild headaches or stomach upset, it's not a miracle cure. If your symptoms are mild, it might be worth a try as part of a blend, but don't rely on it alone. Always chat with your doctor first, especially if you're on blood thinners. I've had patients who swore by it for subtle relief, but others saw no change. Bottom line, promising but inconsistent evidence, proceed with realistic expectations. Now let's move to something with a bit more solid backing. Coming up next, a plant-based compound you might already be getting from your diet that's shown real potential in improving urine flow and bladder emptying. Stay tuned to find out why it's one of the better options out there. Supplement number 2, Beta-Sitosterol, a type of plant sterol found naturally in foods like nuts, seeds, avocados, and vegetable oils. It's often extracted and concentrated for supplements, with claims that it blocks DHT absorption in the prostate, reducing enlargement and easing BPH symptoms. The evidence here is more encouraging than saw palmetto. Clinical studies, including those using a product called Harzol, have demonstrated that beta-sitosterol can significantly improve urinary symptoms, such as stronger stream, better bladder emptying, and fewer interruptions during the night, without actually shrinking the prostate gland itself. A comprehensive 2020 review of multiple trials confirmed these modest but meaningful benefits, with participants reporting up to a 35% improvement in symptom scores. Side effects are rare, typically just mild gastrointestinal discomfort, and it's considered safe for long-term use. One of my patients, a 65-year-old retiree, added a beta-sitosterol supplement to his routine and noticed he could finally sleep through the night without multiple trips. It made a real difference in his quality of life. You can get it from diet by eating more pistachios or sunflower seeds, but for therapeutic doses, a supplement might be needed. Overall, this one gets a thumbs up for evidence-based relief, especially if combined with lifestyle changes. But let's not stop there. Next is a traditional remedy from Africa. In just a moment, I'll dive into an ancient bark extract that's been used for generations to soothe prostate inflammation. The studies might surprise you with its potential for reducing those pesky nighttime urges. Number 3. Pygeum, sourced from the bark of the African plum tree, also known as Prunus africana. This supplement is praised for its anti-inflammatory properties, which supposedly help reduce prostate swelling and improve urinary function in men with BPH or prostatitis. Digging into the research, an older Cochrane review from 2002 analyzed 18 studies involving over 1,500 men and found that Pygeum modestly improved symptoms, including less frequent nighttime urination, stronger urine flow, and reduced residual urine in the bladder. More recent lab studies suggest it protects prostate cells from oxidative stress and may even have benefits for chronic prostatitis by modulating immune responses. However, the evidence isn't ironclad. Some experts note that many trials were small or short-term, and long-term effects compared to placebo aren't always superior. Side effects are uncommon but can include nausea or abdominal pain, and sustainability is a concern since overharvesting has threatened the tree species. In my practice, I've recommended Pygeum to patients with inflammatory prostate issues, and about half report noticeable relief within a few weeks, especially when paired with other supplements. If you're interested, look for sustainably sourced versions. It's not a standalone fix, but it has historical and some scientific merit. Now shifting gears to something red and antioxidant-rich. Up next, a powerful pigment found in your favorite Italian dishes that could play a role in prostate cancer prevention. But is the hype real? Let's break it down. Supplement 4. Lycopene, the vibrant red antioxidant that gives tomatoes, watermelon, and pink grapefruit their color. It's heavily marketed for prostate health, particularly in reducing the risk of prostate cancer and lowering PSA levels, a marker for prostate issues. What does science say? Observational studies have linked higher dietary lycopene intake to lower PSA and a reduced risk of aggressive prostate cancer, with one large Harvard study following over 47,000 men, showing a 21% lower risk among those consuming more tomato-based foods. A 2017 meta-analysis of clinical trials suggested that lycopene supplements might slow cancer progression in some cases, but results for BPH symptoms are mixed and not strongly supportive. The key is absorption. Lycopene is better absorbed from cooked tomatoes with a bit of oil, like in pasta sauce, rather than raw. Supplements are generally safe, but high doses can cause digestive upset or skin discoloration. I've advised patients at higher cancer risk to incorporate more lycopene-rich foods, and some have seen stable PSA readings over time. It's more preventive than curative, so prioritize food sources over pills for the full spectrum of benefits. Speaking of essential nutrients, let's talk about one that's concentrated in the prostate itself. Get ready for a mineral that's vital for prostate function, but can be a double-edged sword if you overdo it. This one comes with a strong warning from studies. Supplement 5. Zinc, an essential mineral found in high concentrations in prostate tissue, where it helps with cell growth and immune function. Supplements are pushed for preventing prostate cancer and supporting overall health, but the evidence is nuanced. While zinc deficiency is linked to higher cancer risk in some populations, supplementing when you're not deficient doesn't provide clear benefits and can be harmful. Alarmingly, the health professionals' follow-up study found that men taking more than 75 mmol of zinc daily had a 2.9 times higher risk of advanced prostate cancer. For BPH, there's little evidence it helps symptoms. Stick to the recommended daily allowance of 11 mmol from foods like oysters, beef, or beans, and get your levels tested before supplementing. In my experience, patients with confirmed low zinc have benefited from modest doses, reporting better energy, but excess is a common mistake leading to copper imbalance or nausea. Use caution. This one's not for everyone. Now, onto a seasonal favorite that's surprisingly effective. Next, an oil from a familiar fall vegetable that's rivaling prescription drugs in studies for BPH relief. You might have it in your kitchen already. Supplement 6. Pumpkin seed oil, extracted from the seeds of pumpkins and rich in phytosterols, zinc, and antioxidants. It's claimed to reduce prostate inflammation and improve urinary symptoms. The science backs this up. A 2009 randomized trial in Korean men with BPH showed that pumpkin seed oil, alone or combined with saw palmetto, significantly improved quality of life scores, urine flow rates, and reduced nighttime frequency, performing similarly to some prescription meds without the side effects. Other studies suggest it may even slightly shrink prostate volume over time. It's safe, with few reported issues like mild allergies, and you can get benefits from eating roasted pumpkin seeds as a snack. One patient of mine switched to this after side effects from meds and found it gentler yet effective for his symptoms. Definitely one of the stronger contenders here. Last but not least, a herb that's as prickly as its name suggests. Finally, a common weed extract that could team up with others for better results. The evidence might make you rethink your garden pests. Supplement 7. Stinging nettle root from the Urtica dioica plant, known for its anti-inflammatory and diuretic properties. It's often used for BPH to improve urine flow and reduce urgency. Clinical trials support this. A review found it enhances urinary symptoms and quality of life, especially when combined with saw palmetto, showing better outcomes than placebo in reducing nighttime voids. One study with over 500 men confirmed improved flow rates. Side effects are mild, like skin rash from handling the plant, but capsules are safe. It's a good add-on for holistic approaches. Now, tips for choosing quality. Always opt for third-party tested products with labels like NSF or USP to ensure purity and potency. No contaminants like heavy metals. Check for CGMP certification, meaning good manufacturing practices, and avoid fillers or artificial additives. Start low dose, monitor for interactions with meds like blood pressure drugs, and consult your doctor. Lifestyle is key for prostate health. Adopt a Mediterranean diet full of fruits, veggies, fish, and healthy fats to reduce inflammation. Aim for 150 minutes of moderate exercise weekly, like walking or swimming, to maintain weight and improve blood flow. Get adequate vitamin D from sunlight or foods, quit smoking, limit alcohol, stay hydrated, and manage stress with yoga or meditation. These can prevent or ease symptoms better than supplements alone. To avoid scams, beware of products with miracle cure claims, celebrity endorsements without proof, or those sold only on shady websites. Check for FDA warnings or recalls. Buy from reputable retailers, read independent reviews, and steer clear of auto-ship schemes. Your challenge: pick one evidence-based supplement or lifestyle tip to try this week, then comment on your experience below. Thanks for watching. Take charge of your health today. Next week, the best foods to supercharge your prostate naturally. You won't want to miss it.